a top burns specialist has given a rare insight into the impact on healthcare professionals of treating Bali bombings victims. On the eve of the 20th anniversary of the deadly blasts, Mark Duncan-Smith, now the president of the West Australian branch of the Australia Medical Association, has recounted his experience. Many survivors were flown to the Royal Perth Hospital for life-saving treatment in the days and weeks following the terror attack. Read more: How Bali Bombings police operation has prevented more attacks. Duncan-Smith worked 12-hour shifts in theatre, work that he described as very intense. It was not just the burns unit team, it was the whole hospital that responded. All the plastic surgeons in Perth were offering help and the community was behind us, he told 9 News. My family supported me because they understood what was going on, but look, I didn't see my kids for probably nearly a week. I'd get home after they went to bed, I'd be gone before they got up in the morning. It was just what we had to do, the work was in front of us and it had to be done. Read more: Where Bali Bombings memorial services are taking place in Australia. The theatres all had to be kept at temperatures well above 30 C, and the more technical operations took 12 hours. Anthony Svilicic was one of the patients who spent hours in theatre. He suffered burns to 64% of his body and was in a coma for 44 days. My life was hanging in the balance there for a bit, and both Dr. Smith and Dr. Fiona Wood performed some emergency surgery on me, he said. This involved replacing all of the skin on my back with some new skin, which had been grafted from other areas, and then using the spray-on skin technology to seal those wounds. That week established a blueprint for Royal Perth Hospital, and the same plan was used to treat the victims of the Ashmore Reef disaster. Read more: Government watchdog launches fresh investigation into Optus. 5 asylum seekers died when a boat exploded in 2009 and 23 burns victims were flown to the Royal Perth. Duncan-Smith took the clinical lead. I am not going to say that we took it in our step, it was still a big effort, but it really meant that those protocol, those systems, and the teamwork was already established. Survivors, hospital staff and the public will attend a dawn memorial at Kings Park on Wednesday to mark the anniversary of the Bali attacks.